Great. Howdy, and thank you for joining us this morning for our lecture with Dr. Hoffman titled The 87th Texas Legislative Session and its Impact on Healthcare for Transgender Residents. My name is Marisol Moreno, and I am the Diversity Program Coordinator for the University Libraries, and it's a great pleasure to co-host this event alongside Frey Miller, President of Transcend. One of the library's purposes is to promote diversity awareness in education, addressing equity, diversity, and inclusion topics that affect both employees and the university libraries community through programs and events.
Howdy, my name is Frey Miller. I go by he, they, she pronouns, and I'm the president of Transcend. Transcend is a community and advocacy organization for transgender, non-binary, and gender non-conforming individuals in the Bryan-College Station area. We serve both students on campus as a student organization, but we're also open to non-students within the general BCS area. Currently, our main purpose is basically to provide valuable information and resources when it comes to the processes of legally, medically, and socially transitioning for trans people. And then we also serve to create a protective and affirming community space for trans individuals to create a space where they can both share their experiences with one another, swap resources back and forth, and also just form very, very valuable connections and friendships. I'm super excited to talk with the Library Diversity Advancement Committee today and to have Dr. Matt Hoffman come and speak with us.
Thank you, Frey. So before we get started, I'd like to begin with a land acknowledgement. We acknowledge that Texas A&M University College Station is situated on the land of multiple Native nations, past and present. These original homelands are the territory of Indigenous peoples who were largely dispossessed and removed. We specifically acknowledge the traditional stewardship of this land by the Tonkawa, Tawakoni, Weko, Sana, Wichita, and Quawetecan peoples. We pledge to support and advocate for the histories, cultures, languages, and territorial rights of historic Indigenous peoples of Texas and the Indigenous peoples that live here now. This statement affirms continuous Indigenous presence and rights, acknowledges the ongoing effects of settler colonization, and supports Indigenous struggles for political, legal, and cultural sovereignty. For more information about Indigenous territories and to find out whose land you're on, you can visit www.nativeland.ca or text the name of your city to 907-312-5085. You can also follow #LandBack on social media platforms to find and support ongoing direct actions for restorative and Indigenous sovereignty. We thank the Indigenous Studies Working Group at Texas A&M University for providing guidance, language, and resources for this acknowledgement.
Just to ensure the emotional and physical safety of everyone attending this presentation today, we have a couple of community expectations for attendees. If you could please silence your microphones while you are watching and participating in this lecture, just to be respectful of the speakers, and also be respectful of each other in the chat while interacting with each other. We are going to be using the chat function of Zoom to submit questions either to Marisol or for a Q&A session afterwards. If you do not adhere to these expectations, we will remove you from the Zoom call, again, just to ensure the safety of everyone involved. The lecture is going to take about 45 minutes, and then the Q&A will be 15 minutes towards the end. Thank you. I am super excited to have Dr. Matt Hoffman here with us. We rep him in Transcend all the time. He's basically our go-to guy for all of the trans students who graduate and are looking for transgender medical resources outside of campus offered in Butyl. He is fantastic. He's had a super long career teaching at A&M. He's currently teaching advanced pharmacology, advanced pathophysiology, and he also runs he's a family nurse practitioner and has his own clinic. He is involved in a lot of different organizations outside of teaching, including the Faculty Senate, the Faculty Senate Caucus, Sexual Assault Survivors Services Committee, and he also works at the LGBT Pride Center. He is just fantastic. He has a ton of professional experience. He has been given several awards and is part of the Sigma Theta Tau International Nursing Honor Society. He is recognized a lot for his work in providing safe and supportive spaces within medical communities and within practitioners. And he is an expert on the legislation. So I'm very, very happy to have him speaking, and I hope you all welcome him in.
Thank you so much. Thank you everybody for attending as well. I'm going to get my presentation loaded so that way we can get started and make the most of our time and have enough opportunity for questions and answers as we go. Is everyone able to see my presentation? Perfect. All right, so I would be ashamed to the educational community if I didn't at least have a list of objectives. So the objectives shouldn't be any surprise. They're pretty much everything that we've talked about, from discussing the current state of access and affordability in Texas. We'll spend a majority of our time talking about the impacts of the 87th legislative session, specifically regarding the provision of healthcare for transgender residents, although I do provide a bit broader health context as well for all residents. And then I've provided a list of state and national organizations that help support Texans as well as transgender residents in a variety of ways. So we'll first start by looking at access and affordability of healthcare in Texas. And I'm going to pull back to a bigger perspective for a moment and looking at the amount of fewer visits and fewer physicians that are available in the United States compared to other countries. So as you see here, we've got the average physician visits per capita in 2017. You see the United States is right there, 4.0. And then when you look at that compared to the practicing physicians per 1,000 population in 2018, you see the United States is at the very, very bottom of the list. So I provide that just as a little bit of background and context to what we have more closely in the United States and the division of access and numbers of physicians and patient care. So you can see based on the lighter number, I'm not sure how big this is on your screen, but we again in Texas are at the bottom percentage in terms of rates. So there is a primary care shortage nationwide. A lot of medical students upon graduation are going into specialty areas, and not many individuals are remaining in primary care, which is what I'm involved in and passionate about. And certainly one of the areas that serve as an entry point, or ideally should serve as an entry point into healthcare access. So I want to give another perspective here. Texas ranked across the other states. I did a little reverse filter or reverse sorting, if you will, and just started at the top 50. And you can see, or bottom 50, I should say. Texas is ranked 45 out of our 50 states, but we are 50th in healthcare affordability, and you can see 50th as well in health insurance enrollment. So when we're talking about access to healthcare, we're not talking about just the brick and mortar locations to go to, but some of the other facilitating contributors that really promote or provide an impetus for seeking out care. And certainly if an individual is not insured, the financial component is certainly a barrier for seeking out care. And then given the nature of the affordability or lack of affordability in Texas, as demonstrated by this chart, that also is going to further exacerbate that disparity in terms of seeking out and looking for care. So one of the things that we see from the latest data from the US Census Bureau, we continue to see the rate of Texans without health insurance continuing to rise. 2 years in a row, we've been able to see that. In 2018, 17.7% of Texans, and that equates to about 5 million individuals, did not have any health coverage. Again, that was up both years from 2 years, and Texas ended up with almost double the number of uninsured individuals compared to the average in the nation. And Texas was one of 9 other states that did report an increase in the uninsured rates. Because of the COVID-19 pandemic, the Census Bureau is not releasing its standard 2020 American Community Survey, or the ACS, which this information was derived from. And instead, they're providing 1-year estimates on the impact based on the trajectory that they've been able to formulate. Again, the data really wasn't consistent because of the lack of collection of that data because of COVID. And so the 2019 ACS estimates indicate that there's a percentage of about 17.5% with a plus or minus 0.2% margin for error. So if we look at the 17.7% and consider where we were, if we're 17.5 in 2019 plus or minus 2, we might end up right exactly along that same threshold. So again, we're not really seeing too much of the ball moving forward in terms of getting more individuals enrolled in healthcare coverage in the state. I could go on about why that is, but that's a whole different lecture in and of itself. And I wanted to provide just one more overview from the Commonwealth Fund. This is their 2020 scorecard specifically of Texas. And you can see, again, our national rank. This one, we've got several different criteria compared to the first table that we saw, but nationally ranked 51 out of access and affordability. They do include, I believe, Puerto Rico in this chart. So again, it really is supporting, this is the most recent data, 2020, of how we compare. And again, it's really not very favorable in terms of Texas. You can see that we're worse than average for overall performance, and we're really not seeing too much change in terms of how we've changed the state of healthcare in Texas itself. So with that under our belts, we're going to jump into looking at the legislative session. As mentioned in the description of the talk, there was a lot of media attention on our legislative session for a variety of reasons. And I've purposefully created this talk to be as nonpartisan as possible so that we can really, from a non-biased lens, just look at the facts, look at the information. So hopefully that's conveyed throughout the slides. When we look at the 87th legislative session, the regular session started at the beginning of the year on January 12th and concluded on May 31st. And then, because of the lack of the key topics that Governor Abbott was hoping to accomplish, he called this special session 1. And I believe we're all familiar with what happened at the end of special session 1, how there was no longer a quorum for anything to get passed. We ended up having special session 2. And again, each special session was a result of not enough legislation on the governor's topics being completed or passed or addressed. So I'm going to move forward now, just talking briefly about some of the healthcare components of the regular session topics. So right out the gate, Governor Abbott came out saying that he wanted to enforce a ban on youth participation in sports that align with an individual's gender identity. There were also topics included in terms of middle and high school education about dating violence, domestic violence, and child abuse. I include that here because certainly all of those are implicated in healthcare in one way or another, whether it be sexual health or physical health and well-being. The prohibition of abortion services, which certainly garnered a lot of media attention, as well as the first bullet point. And then Additionally, telemedicine services, since we were experiencing a lot of change in the healthcare environment with regards to COVID-19, making more telemedicine services available as well as reimbursed to clinicians was a great topic that the governor brought forward, as well as some general COVID-19 relief, including vaccine distribution and access. And then he also included a topic of improving the number of uninsured Texan residents. And there were a variety of ways with which that might have manifested, but this is ultimately the main components in terms of a healthcare focus that I wanted to bring forward. So the outcomes from that regular session, again, as I mentioned, there wasn't a lot of many of his topics that were passed. And what we did see in terms of outcomes, these bills were passed and certainly are going to significantly help improve the ability of healthcare clinicians to be able to provide for their patients. So House Bill 4, delivery and reimbursement for telemedicine services, was approved, along with expanding rural broadband, which certainly from a telemedicine access and availability standpoint, that broadband internet connection is going to increase the access to telemedicine services for those living in rural communities. And then, as I mentioned, vaccine protocol updates, as well as availability and distribution. And then there were also mental health components that were passed. The Mental Health Condition and Substance Abuse Disorder Parity Awareness Month, which is October, it was approved to be regularly observed along with appropriate community activities to increase awareness and education of all of the available benefits the available benefits for medical conditions or mental health conditions and substance abuse disorders. So certainly positive outcomes there, but again, not enough to just let the legislation for the 87th session end. That brought us to the special session 1, and the governor's call brought forward several different components. Again, specifically really wanting to focus on the ban on youth participation in sports that align with gender identity. So all of these bills that were introduced would require K through 12 youth to participate in sports according to their gender on their birth certificate, essentially preventing or banning transgender youth from participating in line with their gender identity, and essentially barring them from creating those formative friendships, education, teamwork, and health benefits that go with playing a sport. There were also a variety of bills not on the governor's call that were introduced. Again, those that were in support of banning the best practices to affirming healthcare for transgender youth. For example, there were the religious refusal protections. Those 2 bills that were introduced were specific to offer healthcare providers the ability to refuse any participation in healthcare delivery that they believed was religiously contradictory to their beliefs or morals. There was also a professional liability insurance bill that was introduced, which basically said that professional liability insurance may not include coverage for any damages that resulted from providing care for gender transitioning or gender reassignment procedures or treatments. So that certainly was a big jab for clinicians such as myself, a big concern, I should say, in terms of continuing to monitor the legislation. The next one was counseling and therapy access. So this bill specifically said that a mental health care provider could not provide gender affirming therapy or counseling to a child, especially if it was to treat gender dysphoria, and if the purpose of the therapy or counseling was to affirm a gender that wasn't consistent with the individual's biological sex as determined by their sex organs, chromosomes, and endogenous profiles. So again, this is just another way in which we're seeing with these past 2 bills, actually past 3 bills, we're seeing some encroachment upon pulling away or not having access to select healthcare services from individuals for individuals. So for example, medical providers would not be incentivized perhaps to provide transitioning care or services if they did not have liability coverage for those specific services. So next in the list was child abuse definition. So this one really was looking at individuals prescribing, performing, or consenting to the treatment or procedure on a child for the purpose of gender transitioning or gender reassignment that was constituted as child abuse. There was an exception that was provided, however, for intersex children. And then there were also gender marker bills that were proposed specifically pertaining to birth certificates. So this basically said that all birth certificates had to have a form or a space for recording of the biological sex as either male or female. So again, defining and just establishing that binary, or perpetuating the binary, I should say, and also prohibited from any amendments which would either issue, a court could not order it, or amend a birth certificate that incorporated any corrected biological sex information for a minor unless there was a clerical error, if there it did not list the minor's biological sex, again, potential clerical error, or if there was a minor that was born with atypical or ambiguous genitalia at birth, and then their sex was later determined, then that was the exception with which the change could occur. So, or those were the three exceptions with which change could occur, I should say. So the overall outcomes from that first session, all bills, even those that were approved by or passed by the Senate, they died because the House didn't have a quorum during the session to be able to let the legislation pass. So that brought us to the second special session. We're looking at the governor's call topics again, bringing to the table that ban on youth participation in sports. Again, really calling for a reiteration of any of the legislation that was previously approved, either in special session or regular session, to make sure that it is addressed and brought forward. So we see the same types of bills, just in different numbers for this session. So again, the bills not on the call were professional liability insurance once again. We see counseling and therapy restrictions, child abuse definition, as well as those religious refusals. The only thing we really saw drop off here were the gender marker points, specifically with regards to the birth certificate. The progress, there was some progress made on the special session. Specifically, we see that Senate Bill 2, really all of the progress being made on the sports participation legislation. Senate Bill 2 passed the Senate. The House Bill 25 and 96 were both referred to public education committees. However, we see that all of those bills mentioned previously, they died because of their failure to be approved or passed by the House. So again, we landed ourselves in the third legislative session. We have the governor calling for that participation ban, and not on the call. This should be familiar by now. We're seeing the bans on those best practices, everything that I mentioned before in terms of the liability insurance, gender affirming care, the definition of child abuse, and then we see the religious refusals and the gender markers and the birth certificate bill resurfaced in special session 3. The progress that was made on these, we did see that House Bill 25 passed through committee, and it was passed by the full House on the second and third readings on October 14th, and it was then passed by the Senate on October 15th. The Senate Bill 3 passed full Senate and then was referred to committee, and then we saw House Bill 10 just referred to committee as well. In the end, we ended up seeing the overall outcomes being that House Bill 25 relating to requiring public school students to compete in interscholastic athletic competitions based on biological sex. It did pass the legislature this past Sunday on October 17th. So it passed committee, full House, Senate, and here we are. So the big thing to focus on in terms of the impacts of healthcare on healthcare and transgender residents is we're continuing to see just a lot of legislation that focused on limitation either to education, access to care, as well as either it being the specific care of mental health and therapy, or potential impacts to provider availability based on potential restrictions to healthcare liability. And the overall delivery of care, specifically some of the bills mentioned gender affirming hormone therapy and how it would be contradictory to practice to be able to provide a supratherapeutic dose was the language, supratherapeutic dose of testosterone to a biologic female. So again, the legislature really got into medical practice, although some critics have said that the legislature didn't really look at the established guidelines and measures and the data that verified the efficacy and safety of gender affirming hormone therapy. So again, the sexual health promotion and education component certainly is important for our youth, but provision of the counseling and therapy services are cornerstone to many of the later points of transitioning, specifically when we're looking at gender reassignment surgeries and procedures. And as I mentioned earlier, the professional liability insurance component was certainly a topic that personally had me quite anxious and really motivated to follow the legislation to see how that would affect my personal practice. The sports ban, as I mentioned earlier, it's really unfortunate that it ultimately is going to put vulnerable kids at risk for further harassment, exclusion, bullying, and most likely block them from the important health, social, and emotional benefits that we know sports participation and youth really should be benefiting from. And the big thing to think forward, the possible recurrence with the 88th legislation, when that session comes, we're not necessarily guaranteed that these are going to be off the table or not a focus, especially since we did see that some of these got passed into committee. Historically, anytime that movement does occur, we certainly see that some legislators feel that that's encouragement to continue to fight for that fight, whatever it may be, or fight for that cause. So certainly this is not entirely behind us. One of the big things, especially kind of forward thinking to resources, I wanted to provide just a list of state and national organizations and resources. So that way, if any of these topics you are passionate about and would like to contribute to or look into, you might be able to help lobby if these topics do come up in future legislative sessions as well. So from a state standpoint, the American Civil Liberties Union of Texas, or ACLU of Texas, Equality Texas, they did a really great job of chronicling and updating their followers of all of the special sessions and continuing to track this very important legislative progress. And then the Texas Civil Rights Project, as well as Texas Freedom Network and the Transgender Education Network of Texas, all very excellent state organizations with very prominent presences on social media. So certainly look them up, Twitter, Facebook, Instagram, whatever you partake in. And then national organizations. As I mentioned earlier, there was the Texas chapter of ACLU. There's the National ACLU, along with GLAAD, the GLBTQ Legal Advocates and Defenders, otherwise known as GLAAD, the GLSEN, Human Rights Campaign, Lambda Legal, along with National Center for Transgender Equality, PFLAG National, and there are oftentimes either state or local community chapters of PFLAG as well, the Trevor Project and the Transgender Law Center. I tried to make sure to include a variety of legal resources as well for any trans individuals or GLBTQ IA plus individuals that may need them at any point in the future. So I'm very excited and passionate about this. So I realize I talked really fast and got through my presentation much sooner than I meant to, but all of my graduate and undergraduate students would say that's pretty consistent with my lecture delivery style as well. So with that being said, I am happy to open the floor for questions. We'll have plenty of time now. And is somebody going to read me the questions or do I need to read them? I'm happy to do it if I need to.
Sorry, I'm trying to mute myself. There's one question that just came, that went in earlier. It was, I noticed early in your presentation, I noticed Texas is ranked #1 and #4 in child dental and child visits. What are your thoughts on that?
Yeah, that's really a great observation and excellent question. So fortunately, Texas does have a really good healthcare system in WIC and CHIPS. So we do have some healthcare resources really guided towards certain populations, especially children, as you can see from the child dental and wellness visits. So that certainly, as you can see, when we look at adult dental and adult wellness, is not something that's carried on into the larger population as a whole for a variety of reasons. But again, the biggest component being the availability of CHIPS insurance for children. Great question.
Thank you, Dr. Hoffman. There's a couple more questions in the chat, but again, if probably didn't state this earlier, if you would like to ask the question yourself, please feel free to raise your hand in the reactions shown at the bottom. And we'll do our best to give you the opportunity to ask the question yourself. So the next question is the liability insurance and mental health care legislation focused on care for children minors, or is it inclusive of adult care?
Another good question. Yeah, the bills were specifically focused on the gender. Let me backtrack. The professional liability one, I believe that was for all gender transitioning services. So that one, I don't recall reading anything specific to an age group or population. So certainly there's nothing to prohibit. For example, I had mentioned multiple times how that was concerning to me. There's nothing that would prohibit me from continuing to provide the care that I provide to trans residents here in the Bryan College Station region. But certainly it would be a fear if there were to be any malpractice suits that might arise later on due to any events that might occur. So again, that one I believe was in the population as a whole overall, but the specifics with regards to the counseling and therapy, that was specific to minors, as well as the child abuse, of course.
Yeah, I see Frankie, your hand is raised.
Yeah. Hi, Matt. Great presentation. Quick question. Arkansas earlier in the year allowed nurses and pharmacists to ban or to decline care for LGBTQ patients. And I know other states have that on the books. Do you have any sense of where Texas or other southern states fall in? Well, mostly just Texas, where we sort of fall in possibly having something like that.
Yeah, so I think that that's really where we started to see some of the religious exemptions that were being proposed, where an individual could refuse based on those religious rights or that religious objection. So I think that it's on the radar, certainly. I love that you mentioned all of the variety of healthcare professionals, because one of the things I noticed in reading many of the bills was that the language was very physician centric. So as an advanced practice registered nurse, it didn't necessarily entail me professionally because it didn't line item provide that definition of all of the miscellaneous healthcare providers, but did specifically say physicians. So again, I think that would be a potential issue that they might come across with future legislation if things aren't addressed and to encompass the entire healthcare spectrum of providers. But I think that's really where we kind of saw the initial emergence of that type of legislation to provide healthcare providers that option.
Okay, the next
I hope that answered.
Next question is, can you speak to the results of forcing trans youth to wait until they are legal adults?
Yeah, certainly. So this is my own opinion. Certainly there would be other providers that might have varying viewpoints, but again, that's the whole umbrella of practice, right? So the big thing that we see, there are a lot of studies that do show some improved outcomes among trans population, especially when they are treated in youth. So for example, there's a twin study that I can recall, and twin studies are really kind of hard to come by, but especially among trans population. So twin studies actually showed that individuals that received puberty blockers prior to having reached puberty had more successful phenotypical or presentation as passing later on after they did transition. So for example, what would happen is if you had two individuals that were designated as male assigned at birth, and then those twins, one identifies as trans and then has puberty blocked. In that situation, the individual that did not, the cisgender, I should say, cisgender individual, that twin grew to over 6 feet tall, whereas the trans individual may be capped out at 5'8", 5'9", which certainly, genetically would tell us, okay, comparatively, this individual may have ended up being 6 foot if they had been able to achieve a natural puberty, if that makes sense. So essentially, we're seeing that individuals, though, without that initial flood of the opposing sex hormone, they're having a lot more successful presentation with their transition, which again allows for easier integration into society, not the overabundance of gender dysphoria that might be present, not only just gender dysphoria, but body image dysphoria as well, that occurs with puberty. Because, I mean, anyone cis or trans probably can look back at pictures and recognize, oh, okay, I certainly was awkward during puberty. So whenever you're in, I can't even imagine already the discord that someone experiences at that point in time where they're really just not feeling that this body is theirs because of the way that it's presenting and growing and developing. So again, being able to allow for the puberty blocking to occur early on does have better outcomes, because later on, depending on if they are 18 years of age and are an adult by that point, and able to make their own legal decisions, they can certainly start transitioning at that point in time. However, we might see a little bit more intervention being necessary. For example, as I mentioned, the effects of testosterone over time in terms of the Adam's apple growth, jawline, hair growth as well. Individuals may end up experiencing increased cost, especially by seeking out facial feminization surgery, laser hair removals, and other treatments. So it certainly is doable, and there have been decades upon decades of individuals that have transitioned after beyond being a minor, but certainly the outcomes that we have seen in the research do really promote offering it and making it available earlier on prior to puberty. That was a long answer, so I hope it covered everything.
I know that was a long answer. Could I add on to that as well?
Please, please.
So GLAAD, the National LGBT Advocacy Organization that you had mentioned earlier, actually did a study that showed that trans youth are more likely to attempt suicide at 4 times the rate of their cisgender peers. And this often has to do with factors that lead to body dysmorphia and body dysphoria that come from the result of irreversible developed secondary sex characteristics that happen due to a natural puberty, along with the costs and effort associated with trying to reverse those effects through medically transitioning as an adult, having not gone through the process of puberty blockers. And so in terms of the mental health effects that are given to trans youth who are given the option to take puberty blockers and sort of circumvent the secondary sex characteristics and results of a natural puberty, there are extremely powerful mental health benefits. And also, you know, in that sense, transgender medical care could be considered life-saving affirming care. In addition to puberty blockers being provided to youth, are considered the first stage of medical care by WPATH, which is the World Professional Association for Transgender Health. They're like the leading medical organization that determines medical practices in those standards for practitioners who do care for transgender individuals. And WPATH has considered puberty blockers a completely reversible stage of medical transitioning, which means that providing it to youth, even if they are not certain about their gender identity or still sort of exploring that at a younger age, are able to reverse the effects of puberty blockers later on if they do decide to identify as their biological sex assigned at birth. And this option, completely reversible, allows them the freedom to explore their gender identity without the negative impact of having irreversible secondary sex characteristics in a way that does not align with who they are or their authentic self.
Thank you for that addition.
Thank you both. The next question, it was a couple of questions that rolled in. As an educator, do you have any particular techniques that you use to discuss these topics with students who come to class with a wide variety of experiences, identities, viewpoints, and prior knowledge?
That's an excellent question. And one that I can say there are a lot of efforts that are being put forth with being able to incorporate a variety of elements of more broad social and cultural contributions into our curriculum. So for example, I teach what we refer to as one of the 3 core courses. So the advanced pharmacology, advanced pathophysiology, and advanced health assessment. Those are the 3 core courses that we have for our graduate students in the College of Nursing. And so early on in these in the curriculum, students are exposed to information specifically with regards to approaching patients and discussing gender and kind of recognizing the construct of gender and sex assigned at birth. And so that's incorporated early on, especially in the health assessment component. It's very important because that's where individuals are interacting with patients, and the amount of data and information and surveys out there from individuals that have had negative healthcare experiences because of not having pronouns acknowledged or not being identified by the pronouns or name that they use certainly is a really, really big factor that we want to make sure training our students to recognize and acknowledge and engage in patients correctly and respectfully is certainly something that we include early on in the curriculum and try to weave throughout. There's additionally sorted groups. I'm trying to remember, I know I see her here in the group, Allison Pittman. She's a colleague that's involved in really establishing a medical curriculum for medical or educational curriculum for LGBT education. And I teach a separate course every fall in the College of Medicine, specifically with regards to the LGBTQIA plus health promotion. So within the College of Medicine, we're trying to, this is something, an initiative that students started and requested, and I was happy to contribute to, and it's something that we see across the nation. Allison, can I get you to elaborate on your group and the work that you're doing?
Sure. Can everyone hear me? I am a colleague of Dr. Hoffman's in the College of Nursing. I'm a clinical assistant professor, and we just sort of did a grassroots effort where we reached out to interested faculty across all of the health science center colleges to really come together and improve the education that we provide across all the professions toward LGBTQ folks. And so we're in the process of, we did a faculty survey, we did a student survey, we're doing focus groups just to get an idea of what people really want to learn. And it'll be, it's a slow moving process. We don't have funding. We're just working on our own free time, ha ha ha. So we are trying to really gain some support from both the health science center colleges and from the university as a whole to really improve the education we provide and do it in an interprofessional way where, you know, dentists, doctors, nurses, pharmacists, public health professionals can all learn together.
Thank you so much.
Thank
And
you.
thank you for doing that.
Next question is, do you know if there are any differences being legally defined for those seeking hormone blockers versus testosterone or estrogen?
If I'm understanding the question correctly, there are specific medications. So the hormone blockers are intended for individuals that would be minors. So for example, my understanding is that it might be given to an individual that's going through precocious puberty or an early puberty that's not expected for an individual at that age. Usually it's a hormonal imbalance stemming from the brain. However, it's that feedback system, but essentially it's something that is used to combat conditions like that. However, it would really have its benefit solely from the pre-pubertal standpoint, simply because we want to prevent that cycle of the non-desired sex hormone being flooded throughout the body. When an individual has already achieved puberty, the hormones are already present. The damage has been done, essentially, if you will. And at that point, our goal is to essentially reverse or suppress the non-desired hormone by supplementing with either testosterone or estrogen. along with miscellaneous testosterone blockers that exist as well. So that is a differentiation as well. The testosterone medications that suppress medications that suppress testosterone versus just the hormone puberty blockers, if you will. I hope that answered the question.
If I could add on to that as well, sorry, I
Go for it.
love referencing WPATH. But in terms of, you know, the legal definition or the definition between, or the separation between hormone blockers and HRT, hormone replacement therapy, which is the use of testosterone or estrogen to initiate secondary sex characteristic changes through sort of like a second puberty as part of a medical transition process for trans people. Again, those are separated into two different stages within WPATH standards of care for trans people. Hormone blockers are completely reversible. They can be used in supplement with HRT in terms of anti-androgens, blocking testosterone for increased effects of estradiol or estrogen HRT. And then for the use of HRT, estrogen and testosterone HRT have some irreversible effects, but also have some permanent effects, which is why they are categorized as like stage 2 treatment by WPATH's standards of care. And they're, the WPATH standards of care does require practitioners to sort of log a period of time in between each stage. So if a transgender youth started off on hormone blockers, which again is completely irreversible and sort of a stepping stone towards other stages of transitional care, they would have to sort of live as their gender identity and present as their gender identity for a certain amount of time before they progress to the next stage, which would be sort of a mix between irreversible and reversible medical effects. And this is to sort of give the youth family and the youth you know, time to adjust to their gender identity, sort of explore the mental effects and the social effects of living as that gender identity, you know, before pursuing irreversible changes, which again protects the youth and gives them the flexibility of making that decision, but again also provides that opportunity for them to circumvent the irreversible changes of a natural puberty. So in terms of the differences, they are sort of categorized as two stages because they do have different levels of irreversibility. And you know, hormone blockers is sort of like the first stepping stone stage with a period of transitional time in between.
Thank you, Frey. We've got two more questions. One is, do you know if there are any type of formal statement from a Texas-based chapter of the American Academy of Pediatrics on the harm that this legislation would cause children and young people?
That's a great question. I'm not aware of any formal statement, especially from chapter levels. I think that again, it's really very controversial for national organizations to make statements along those lines, but certainly many mental health organizations have spoken out specifically with regards to the negative impact on the legislation that we had about sports and activity. So I'm not aware of any at this point in time, but if any of my colleagues in the group are aware, please feel free to share.
I don't know of any organizations that have made a statement sort of like specifically condemning the legislation and talking about the harm that it would cause transgender communities. But I do know several organizations that have sort of backed up WPATH's standard of care in terms of like, you know, endorsing these transitional resources for young people. I know that the Human Rights Campaign Foundation has endorsed the WPATH standards of care, as well as the American College of Osteopathic Pediatricians and the American Academy of Pediatrics. And in terms of, you know, national level authorities in sports equality and sports competitions, endorsing, inclusive qualities and inclusive policies for transgender athletes. The NCAA and the International Olympics Committee have incorporated very inclusive and completely inclusive policies for transgender athletes to participate on the teams of their preferred gender identity. So there are very leading national authorities that are trying to represent transgender equality and transgender rights against this legislation.
And I'd like to add to that Frey has mentioned WPATH for, and that is certainly one of the guidelines, but there's also another organization, the University of California at San Francisco. They have their own statements that really do support the WPATH guidelines. I use a combination of their literature from both WPATH and UCSF whenever I'm providing information to patients, because they really are synergistic in terms of their support for transgender populations. So it's nice to see there's another academic institution out there and healthcare center, resource center, I should say, that are promoting these guidelines and the standards of care.
This next question is kind of an extension to what you both mentioned about large organizations supporting and promoting better standards of care. In terms of, what individuals can do to show support for the LGBTQIA plus community, what can they do? What you had shared a couple of state and national resources, and also Dr. Pittman's efforts here at A&M to improve education. So what do you say to people who want to help support
Sure.
healthcare and efforts?
Yeah, I love that. And it's really one of those things where recognizing what your own strengths and abilities are. I have learned years ago that I do not have the social stamina to lobby on Capitol Hill. I've tried it in DC. That is just not something that I can do. I end up leaving a hollow shell of myself scattered along the Capitol. But there are people that do have that and do have the passion and are able to share it and are really, really great voices. So recognizing whether your assistance can be either monetary, all of these organizations certainly, for example, Texas Equality, you could go to their website and sign up for their subscriptions to their newsletters. They will keep you abreast of any news advancements, as well as any opportunities that there are to help serve. So for example, while all of this was going on, there were many, many calls for individuals such as myself or individuals that were living the high school trans sports life. There were many individuals that went to Capitol Hill and testified, but there are also opportunities to assist their lobbying and their efforts financially as well. So connecting with an organization that you really feel strongly about their mission and finding the way that you would be able to best support is really the ideal way of finding what your niche is and being able to continue to contribute and advance what we're doing, as well as be an ally and help support the missions of the groups.
If I could add on to that as well, as a trans college student, living in Texas and sort of facing the backlash of this anti-trans legislation, especially the large multi-state wave that happened in spring of 2021. I've noticed that a lot of times the only people helping or supporting trans communities happen to be other people in trans communities, and especially with the fast-paced nature of Texas legislation, where there is bill after bill after bill, and they all have very complicated numbers to remember, and they all move very quickly across the legislative floor. It can be very hard to motivate people to stay informed and stay updated about what legislation is being enacted and how that affects trans communities. And so I really encourage, allies looking to support trans people and to learn about the legislative legislation in a way that helps trans communities to go through an ally training program. I know that the Brazos Pride Community Center has a fantastic ally training program in Bryan, and then on campus here at Texas A&M, there's a fantastic ally training program through the LGBT Pride Community Center. And in addition to that ally training, I also super encourage allies to support grassroots mutual aid movements for transgender communities. There are fantastic trans organizers out there who, organize fundraisers for people who need money for their medical transition, which again, due to mental health issues and due to sort of like trans communities being marginalized, can be life-saving care in some instances. And so supporting trans mutual aid groups, both on a smaller level and on, through national organizations such as GLAAD and the ACLU, and also just keeping informed through legislative trackers and also through legislative advocacy organizations, again, through organizations like GLAAD or the ACLU, is just a super important process. Staying informed can be one of the most helpful things because trans people, we get kind of tired explaining things after a while. I do have, if I could share my screen briefly, I do have a resource that was put together by Transcend last spring. This is a link tree that we compiled of basically a huge collection of both mutual aid organizations and legislative trackers for people just looking to get started. We have a collection of mental health resources put together by various LGBT advocacy organizations, as well as legislative trackers on a national level, but also on a state level for a lot of the states that had a larger number of anti-trans bills proposed. In addition to that, we also have maps of different HRT and medical transitioning resources for trans people, especially on an informed consent level, which is essentially allowing trans people to have access to transitioning medical care simply by understanding the effects of that care and giving their personal consent to the practitioner, as opposed to having to provide them with medical or psychiatric documentation saying that they do experience gender dysphoria, which can be a very long and expensive process. So providing these maps of transgender resources, there's also the WPATH standards of care. We compiled an educational pamphlet sort of talking about the myths and facts of each legislative bill and sort of what effects the legislation would have on trans communities in terms of how each bill has a different goal or target towards trans communities. And then we do have a collection of mutual aid organizations listed by state. So I will go ahead and put the link to this resource in the chat. But yes, that's a very long answer to a very kind question. Basically, supporting trans communities just by staying informed and through monetary means as well, just because medical transitioning is a very, very expensive process. That absolutely means the world to trans folks. As a trans person and also as a trans person who knows trans people, I know that funding medical surgeries or HRT can be absolutely life-changing. So thank you so much.
I know we're a little over time, but I do want to thank again to Dr. Hoffman for presenting and Frey Miller for shining a light on this important topic that transgender residents in Texas are facing and nationwide. So I want to thank everyone for joining us today. I will, within the next 48 hours, you'll receive an email with a link to today's recording and a link to our survey. And I will also include a link to the link tree that Frey mentioned. So you have access to that as well. For the survey, we kindly ask that you help us by filling out our anonymous survey. Your feedback helps us create a better experience for you and others. And with that, I will leave, sorry about that. I will leave final thoughts for Frey or for Matt.
I just thank you all for your time today and your interest. Just your time and attendance here shows an interest and an allyship that is greatly appreciated by myself and the entire LGBTQIA+ community. So thank you.
I'm so excited about the turnout for this event, and I'm so happy that all of you are here. Again, taking the first step of just being educated about these types of issues and understanding how the legislative movements in Texas can affect marginalized communities is just a huge step for everyone. So thank you all so much for giving your time this morning. And again, if anyone has a trans friend or a non-binary peer who is looking for resources, we are Transcend TAMU on Twitter and Facebook and Instagram, and we would happy to have new members and give our resources and our knowledge to them. Thank you all so much.
Thank you, everyone, and have a wonderful day.